email to everyone who registered with a link to the recording, as well as the slide deck and supplemental materials that we're going to discuss during the session. Thank you for joining us today. My name is Amy Gendusa English. I am the project director of the Energy Partnerships Project here at the National Community Action Partnership. And today is an especially good webinar session. We have gathered you here today under the auspices of multiple federal partners. We're going to learn about the Healthy Homes and Weatherization Cooperation Demonstration Grant Program, which is an incredibly long acronym, but I promise you it's worth it if you hear it out. It's $1 million grants available to collaborations between weatherization grantees or subgrantees and Healthy Homes Production grant recipients on the HUD side. So we have folks in our virtual room today from both sides of this equation, and we hope that some of you may leave here today inspired to reach out to a potential partner to apply for these funds. So before I move on, I just want to say that I want to make sure that everyone is aware that we're going to be using the term grantee a lot. And for our weatherization folks, we think about grantees and subgrantees. And then for the HUD folks, they will be talking about grantees and using that term in a slightly different way. So if there's any kind of confusion, please be sure to ask a question or ask for clarification in the question and answer section. What we're going to hear about today from our federal partners, the intent and the capacity of this demonstration program. And then we're also going to hear a case study of how the Indiana Housing and Community Development Authority will partner with the Indiana Community Action Association and Community Action of Greater Indianapolis to use these funds to reduce weatherization deferrals. So like I said, I'd encourage you to use the Q&A function at the bottom of your screen. Our presenters have a lot of content to move through, and there is time built in at the end to respond to question and answer. So at this time, we'll move to the next slide, and I would invite you all to listen to or participate in the promise of community action. The promise of community action. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. Next slide. So it is my great pleasure to turn the virtual screen over to Amanda Rains from the U.S. Department of Energy.
Hello, everyone. I'm Amanda Rains, and I serve as the Senior Policy Analyst for the Weatherization Assistance Program at the Department of Energy. The Weatherization Assistance Program has existed since 1976 with the mission of reducing energy costs for low-income households by increasing the energy efficiency of their homes while ensuring their health and safety. The department awards formula grants to all 50 states, the District of Columbia, 5 U.S. territories, and Native American tribes, which then contract with local weatherization providers to implement the program. Nearly 700 local providers deliver WAP services to an average of 35,000 homes annually using DOE congressionally appropriated funds. We know that more than 39 million households are eligible for weatherization services, though not all are appropriate candidates for weatherization. While some of these homes could become eligible for weatherization through the use of the Weatherization Readiness Funds to address the reasons the homes were deferred, some of these issues, such as lead, could best be addressed by partnering with a HUD-funded program. DOE WAP stakeholders voiced the need for simpler, streamlined processes for intake and qualifying households. So in 2022, DOE's income eligibility was expanded to categorically include HUD mean-tested programs to better facilitate referral services for low-income households. The Weatherization Assistance Program and HUD's Healthy Home Production Grant Program share similar missions of addressing housing-related health and safety hazards for our nation's most vulnerable. Thank you for showing up today to learn more about this funding opportunity to help demonstrate how the coordinated delivery of these services help achieve cost effectiveness and better outcomes in improving the safety and energy efficiency of homes we serve. Now I'll turn it over to Damian Slaughter from HUD.
Thank you. Good afternoon, everyone. My name is Damian Slaughter. I'm a program analyst for the Office of Lead Hazard Control and Healthy Homes. And today I want to talk to you about our Healthy Homes Production Grant. Next slide. So our Healthy Homes Production Grant was part of the HUD's overall Healthy Homes Initiative launched in 1999. We actually just revamped our Healthy Homes Production Program where it went dormant, if you will, for the last several years. However, we just implemented it again because of the need out in our communities. Probably back in 2020, we initially brought it back out. The goals of the Healthy Homes Production Program is to take a comprehensive approach to addressing multiple injuries in homes and focus on housing-related hazards, just to make our families more safe. The Healthy Homes Grant Program supports development and implementation in states and local governments, which I would talk about that a little bit more in a few seconds on another slide for some opportunities that we have currently. Next slide. Thank you. So our main target is the pre-78 homes, post-78 homes in applicant target areas. Our grantees may address varieties of environmental health and safety concerns, including mold, asthma, related health concerns, carbon monoxide, and other elements as well. The grantees must spend 65% of the Healthy Homes funds directly for homes activities. That's very critical for our grants. There's a 10% administrative cost, of course, that can be used for the execution of the grant. We currently included our 10% match. We did discontinue that for a few of the rounds, but now we have that back in the mix where 10% max may be used for additional addressing other hazards. It's a 42-month period of performance. So that will be the length of time that each of our grantees will have to, communicate with their communities, their families in the communities, and address these needs. Next slide. So currently, we have a Healthy Homes Production Grant that's out in publication. The total amount of the award is $40 million, with the ceiling being $2 million and the floor being $1 million. We anticipate having this NOFA out for publication until November the 7th. So you have an opportunity to communicate with our office, get more information about the Healthy Homes Production Grant, and hopefully we will see you actively participate by submitting an application before the due date. Thank you.
Next slide, please. Could you pass to the next slide, Emily or Amy? Thank you very much. I appreciate it. My name is Brenda Reyes, Dr. Reyes. I am a physician for training. I also am the director for the Policy and Standard Division within the Office of Lead Hazard Control and Healthy Homes, which reside in HUD, the agency. I'm going to be discussing or giving some background information regarding the FY 2023 Healthy Homes and Weatherization Cooperation Demonstration. I know it's a full mouth. We're trying to figure out for a short name for it. The Notice of Funding Opportunity. This NOFO, it purpose is to support, the coordinated housing assessment and intervention between Housing and Urban Development Healthy Home Production grantees and the Department of Energy Weatherization Assistance Programs grantees and subgrants. Next slide, please. The objectives of this NOFO is to identify strategies for coordination, reduce the WAP deferral through coordination with HHP programs, to demonstrate sustainable model of inter-program cooperation, such as data sharing, reporting, targeting, etc. We're looking to demonstrate effective models for sustainable financing of coordinated interventions. And we would like to see the support, to support the collection of data to evaluate the housing interventions conducted through this inter-program coordination. Next one, please. The funding, it is a $5 million that we receive for 5 applicants, 1 million per grantee, and it will last for 36 months. Whenever we say maximum and minimum of 1 million is that you can only apply for $1 million. And the applications for this NOFO are due on Tuesday, October the 21st by 11 p.m., 11:59 p.m. This is to the last minute. The applications must include a firm commitment from both programs, meaning make sure that whenever you sit down to discuss, if you are in HHP and you are bringing WAP to participate with you, or the other way around, make sure that both programs sit down and discuss exactly what you're planning to do, meaning what, because you're developing it at that moment. So whenever you are awarded and in the in the middle of the grant, we would like to see that one of the awardees, one of the grantees decide, what, we cannot handle this. So it's extremely important, and I'm making mention of this, because it's at the beginning that you have to sit down and clarify where you're going to be working, what are you planning to do, what would you like as a team, to do. Next slide, please. I'm ready for the next slide. Okay, I see it. Oh, no, I'm sorry. I asked for the 2. Go one back. Thank you. Who is eligible? Which organizations, could apply? And we have, go one slide back. These are ineligible. Perfect. I am messing this up. I apologize. I'm looking for the eligible applicants. This one more slide. Thank you. The state governments, county governments, city, or township governments, special district governments, Native Americans, tribal governments, federally recognized. And we're looking, of course, for non-for-profit having a 501c3 status with the IRS, other than institutions of higher education. Only current holders of an active Department of Energy Weatherization Assistance Program grants and sub-grants, not a contractor or a partnership, or only a HUD Healthy Home Production grant, not the grant sub-grantees, not the contract or any type of partnership are eligible to apply for this grant.
I could interject, Brenda.
Yes, ma'am.
In the beginning, I wanted to clarify the use of the grantee and sub-grantee terminology, because there's the HUD world and there's the weatherization world. So just to be clear, for our weatherization network, technically, the demonstration grant, one of the partners could be a weatherization grantee or a weatherization sub-grantee or a combination of both. So for our purposes, our sub-grantees could go after this grant even without grantee involvement.
Correct. It could be the grantee or it could be the sub-grantee for the weatherization program. For the healthy home production, only the grantee can apply. Thank you for that. I really appreciate it, Amy, because it is very important to make the distinction. And as you said, we use it differently. So, thank you for that clarification. And what I wanted to add also is, if an entity hold both, a WAP grant, and either grant or sub-grant in your case, and a healthy home production grant in the same organization, okay, whether it is implementing the 2 grants from the same office or divisions, or from different offices of division within the same organization, that entity may only submit a single application. We will not accept, yeah, but we are applying using the WAP, or we are applying using the healthy home production. Is the entity the one that hold both of them, or what, the only one that can apply one application? Next, please. Now, who is not eligible? Who is ineligible to apply? This is not a grant for individuals or for federal agencies. This is not a grant for Native American tribal organizations other than federally recognized tribal governments. Organizations that receive the 2021 or 2022 Healthy Home Weatherization Cooperation Demonstration Grant Award are not eligible to apply for this 2023 award. Let me say this again. If you receive a 2021 and or a 20, no, not and, the 2021 award or a 2022 award for the Healthy Home Weatherization Cooperation Demonstration Grant, you are not eligible to apply for the 2023, for this one, Healthy Home Weatherization Cooperation Grant. There is just another thing: the applicants who fail, that we receive, who fail to meet any of the threshold eligibility requirements are deemed ineligible. Applications from ineligible applicants are not rated or ranked and will not receive HUD funding. Next one, please. Okay, who benefits from this grant? It's, as Amanda was saying early, this grant benefit low-income families, which households must include either a young child, age 6 years or under, an elderly person, age 62 or over, individual who is pregnant, persons with disability or any type of illness, poor energy efficient home. Any of them could benefit from the home hazard mitigation. Think about poorly controlled asthma, chronic obstructive pulmonary disease, or, for the reduction of the high energy burden. This fund will allow your organization to cooperate with the HUD HHP grantees or with the WAP grantees and sub-grants, and the braiding of work, the braiding of funds and efforts, reduce the environmental hazards at home and improve the health, safety, and energy efficiency, the conditions of the home of our communities. Next one, please. This is, Amanda started talking about this at the beginning, which is fantastic, especially for the, what weatherization programs, what the Department of Energy has been able to do. For the purpose of the healthy home production grants, we use the 80% area medium income, the AMI, for the income eligibility criteria. The weatherization assistance program has categorical eligibility, with HUD means tested program of 80% AMI or below. What does this mean? Is that whenever we are coordinating services between HHP and WAP clients that are served through the HHP, they will automatically income qualify for WAP. Let me say this in a different way. If the client has qualified for the Healthy Home Production grant, they will automatically qualify, income qualified, to participate or to receive the WAP services. Next one, please. These are the 8 principles of healthy homes. Usually these are, for healthy home production, whenever the assessment is done, these are some of the items that our grantees look for within the house and try to reduce, mitigate, or remediate. And a lot of them are also dealt with the WAP funds. Go to the next one, please. And, oh, nice, that was fast. Okay, this is my contact information in case you have any other questions. And please make sure to add your questions in the chat, basically because we're trying to collect and create a flyer with the frequent asked questions. And in case we don't have the time to respond to all the questions at the end, we will generate an email and send it to everybody that participated on this webinar and put it in our web pages also. Thank you very much. Now I'll pass on the microphone to Samantha Spergel. Thank you very much again.
Thank you. Good afternoon, everyone. My name is Samantha Spergel. I'm the Director of Real Estate Strategic Initiatives and Engagement at the Indiana Housing and Community Development Authority. I'm going to kick it off first to Greg Glassley. He is our Director of Energy and Utility Programs at IHCDA and oversees the state of Indiana's weatherization program.
Thanks, Sam. Good afternoon, everybody. You can switch to the next slide, please. I'll just give a little background on IHCDA. So as Sam said, it's the Indiana Housing and Community Development Authority. Our mission is to provide housing opportunities, promote self-sufficiency, and to strengthen communities. So we have a lot, probably around 60 programs under IHCDA's umbrella. So we, Sam dabbles in the real estate and lives in a HUD world a little bit, and I'm with DOE and HHS. So we are a very unique agency in that sense that we get our hands in a lot of different programs, which has given us this great opportunity that we get to talk about. So we are a quasi state agency reporting to the Lieutenant Governor. So next slide, please. And just our mission and vision, and then just kind of point out a little bit specifically with the weatherization, as Amanda had kind of talked about, but really about housing, creating housing for Indiana's most vulnerable populations is what we target. And then the last bullet point about promoting place-based initiatives, which not exactly weatherization, but again, it's speaking to the quality of life. And that's something weatherization does. And in this opportunity, again, with the Healthy Homes collaboration, that we have this opportunity to improve the quality of life through this grant for a lot of Hoosiers. Next slide, please. And then I'll give you just a very, very brief look into my world that I live in before I hand it off to Sam. But next slide on community programs. So the world that I live in, so I'm Director of Energy and Utility Programs. So that means that I get to help out with the Energy Assistance Program, the Water Assistance Program as it sunsets, and then the Weatherization Assistance Program. Next slide, please. So kind of how we work. So again, we receive money, weatherization loan from DOE. We work with 19 subgrantees, and in the weatherization world, they are all community action agencies. And so they are the ones that administer the program throughout the state of Indiana for all 92 counties. And then as a grantee, we provide a lot of training opportunities, the guidance, oversight, monitoring. We basically try to give as much assistance as we possibly can and guidance. Next slide, please. And you can see this is just a map of, you get the 19 community action agencies and the counties that they cover. So you can kind of see a wide variety in the the upper northwest. We have one agency that covers Lake County, and then some of the other agencies that cover up to, I think, 11 counties. So there's kind of a wide spread in the coverage based on for these agencies. And the one that we'll focus on is the one right in the middle in green, KG, which is Community Action of Greater Indianapolis. That's who we get to partner with for this particular grant. So I will hand it back over to Sam.
Awesome. Thank you, Greg. Next slide, please. So I want to talk a little bit about our Healthy Homes Resource Program. Next slide. So as Greg said, we are in different departments at IHCDA. Greg oversees weatherization program and oversees the entirety of community programs. I am embedded in our real estate department, so we primarily are tasked with the actual bricks and mortar construction of affordable housing. So that includes, if any of you are familiar with the low-income housing tax credit program, and then we have a myriad of other HUD capital resources, including the Home Grant, National Housing Trust Fund. We have utilized the Community Development Block Grant in the past, and we're also the Balance Estate Public Housing Authority as well. So we wear a lot of hats. I'm very lucky in that one of my hats I get to wear is director of our Healthy Homes Resource Program, which actually was a rebranding that we underwent several years ago when we started applying aggressively through the Office of Lead Hazard Control and Healthy Homes for these different resources made available across the U.S. And so currently we have 3 grants that we are very fortunate to administer. So the first is the Healthy Homes Production Grant, which Damien had spoke of earlier. The second is what's called the Lead Hazard Reduction Grant, really highly focused on lead-based paint control and abatement, which is actually our second lead hazard grant that we've received. And then our Healthy Homes Weatherization Cooperation Demonstration Grant. And for any of you online, if you do come up with a smaller phrasing of that, I would be very much appreciative, because I have to say this a lot and Greg giggles every time. So that would be wonderful. And so within that, we have approximately $8 million of funding through the Office of Lead Hazard Control and Healthy Homes to really combat a lot of these health hazards. I do want to note that our Healthy Homes Production Grant and Lead Hazard Reduction Grant are statewide grants, while our Healthy Homes Weatherization Cooperation Demonstration Grant is going to be focused in Marion County, and we'll talk a little bit about why shortly. We are unique in that we are an administrator of both the Weatherization program and the Healthy Homes program. And when this NOFO came out last fall, and Greg and I and his team met to discuss this, we really felt that we were well aligned as a state agency and as the administrator of both these programs to move forward and put together a proposal for our pilot program. Next slide, please. So if any of you have ever applied for any federal grant, I think you will understand that it is a process and a journey, and it's not always very simple. And so I wanted to just go over our evaluation process of how we determined we were going to apply, and then some of the decisions that we made while we were applying on program design. So first and most importantly, we needed to evaluate the capacity of administering this new grant. This grant, and I'm probably going to say this multiple times throughout my presentation, requires strong coordination between your Healthy Homes team and, in our case, the community programs team. But for all of you, if you were interested in applying for this grant, your WAP grantee or WAP subgrantee. And that partnership is so critical for success. Without it, you will not be successful, to be brutally honest. So our first consideration was really looking at the internal capacity and capacity of our community action agency partner, KG, if we were even going to be moving forward. In terms of staff capacity, I always recommend to be mindful of those what we call cross-cutting or cross-sectional regulations, including the environmental review process. And then Section 3, there are other cross-sectional regulations, but all HUD grants do have requirements, and certainly HUD is a great resource to walk you through how to report what those regulations are, but they are required. And so if you are not familiar with those processes and regulations, please assess your ability to think through how to meet those requirements successfully. The next is to really look at who on your team will be responsible for the continued communication between your partners. Again, that communication, that partnership is so critical for success. Who on the team is going to be responsible for overseeing contractors? Who is responsible for conducting the Healthy Homes assessment? That's a requirement under the Healthy Homes Production Grant and this grant as well. Secondarily to that, radon testing, the lead inspection risk assessment also required, and just really understanding if that is the capacity of either partners or if that would have to be bid out, and what does that landscape look like. Who is going to be responsible for HUD reporting? I'll mention that the HUD reporting on our current grants have not been substantial compared to other HUD grants I have administered in the past. But again, there's still items that are required to be done, and really identifying that staffing plan is really important. And then lastly, and this really gets to the WAP grantees and subgrantees, how are you tracking deferrals, and how are you triaging those deferrals, or how do you think you'll triage those deferrals to your program? So sort of a second tier to capacity considerations is the internal capacity of your supporting teams that may help you in successfully implementing your grant. For us, a lot of that was around our accounting team, really for two primary reasons. One, you have to spend $1 million. It can be really easy to spend $1 million, or it can be really hard to spend $1 million. It really varies. And so who is responsible for claims? Who is responsible for tracking? What do those systems look like? And then second to that, how are you going to ensure full compliance with the regulations under 2 CFR 200, particularly the financial accountability requirements? And then lastly, when we think about capacity, we were very lucky in that we had a very strong community action agency, KG. Certainly that evaluation of their ability to partner with us was important. We had preliminary conversations as we began to think through our decision process of applying for the grant to see if, where they felt that they could be an asset to the team, and where those challenges were, particularly on the HUD regulatory side. Since many community action agencies don't necessarily work directly with HUD programming, and the regulations separate from this grant opportunity can be very different. Go to the next slide. So this was the most fun part, and the part that I am constantly rethinking, which is the program design considerations. The really great thing about this grant, as opposed to other grants I've applied to, is that there is a lot of flexibility on program design embedded in the NOFO. Certainly there are, and as I've discussed previously, a lot of federal regulations specifically that must be met under the HUD or the DOE programming. But how you process, how we meet with families, how do we think through holistically addressing hazards? There's a lot of ability to think outside the box, and that was one of the reasons why we decided to move forward with our application, and why we are so excited that we were accepted for funding and are getting ready to kick off our program. As you're thinking through your program design, a couple of additional considerations. So the first is applicability with existing programs. Are there other programs out there in your community that can help supplement your program design? And so examples could include that if you're in an entitlement community, the Community Development Block Grant is a great example. If you have other local or state funds, we'll talk a little bit about this later, but if you have a local or state health department that has funding, partnering with them may help, particularly when you hit caps on what you are able to do to move that family off the deferral list. Secondly is the existing contractor network. I think everyone that works either in HUD programming or in weatherization will note that it is sometimes really hard to find contractors. This is something that we constantly struggle with. We know our partners who we work with struggle with this a lot. And so really that evaluation of what does your existing pool look like? Is this grant a great opportunity to partner with other trade groups? And we have an existing partnership with the Indiana Builders Association. Is there an opportunity to provide targeted trainings? And so we have been able, we are hoping to partner with the Indiana Community Action Agency on providing some trainings. And then, do we need to cast a wider net when we think through our contractor pool? The next is really thinking through referrals, and really this and the next bullet kind of go together, which is really thinking about how can we integrate our local and state health department to provide those referrals. Part of this grant is highly focused on the specific deferrals of the weatherization program. Part of this program is also finding that control group. And so for us, we wanted to make sure that we could identify folks through a partnership with the local or state health department for those families that they had targeted of having individuals that are exhibiting severe asthma triggers, and how can we ensure that we are triaging those individuals to either our cooperation demonstration grant program or to our existing Healthy Homes program. Next, who does what? That's kind of the fun part. And we'll kind of go through our proposed design of who's going to be responsible based on those strengths and those challenges. And then lastly, scaling the program. So with this, it's an evaluation of what does your geographic region look like. So if you are a WAP subgrantee, you may have geographic boundaries that you can only work in. If you're a Healthy Homes production grantee, you may have geographic areas you can only work in. And so really understanding how to layer those to identify where you could potentially target your program. Secondly, again, your contractor pool, which may also kind of dictate where you focus. And then lastly, looking at the NOFO itself, there are scoring categories, and you'll see this in the appendices that'll come out with your slides, where certain geographic areas are considered high need, and you may be more competitive if you decide to target those particular areas. Go to the next slide. So we targeted Marion County, and for those of you who are not familiar with Indiana, Marion County is where the city of Indianapolis is, which is our capital. It's the largest city in Indiana. Almost the entirety of the county, save for what we call excluded cities, are considered a city of Indianapolis. So we're really excited that ended up being our pilot area. And there were a couple of reasons specifically as to why we chose Indianapolis and why we chose to be geographically focused for this particular pilot. So the first, we wanted to do a targeted approach because this is $1 million. This is, again, it can be really hard or really easy to spend $1 million. This really allows us to concentrate in one geographic region. We're also located in Indianapolis, to be really honest, and it also helps us as we think through our monitoring plan. We think through how can we actually actively meet with some of the households, and how can we continue to meet face-to-face with our community action agency. Secondly, we have a really strong community action agency in central Indiana, KG. And I remember one of our initial phone calls when we were determining whether or not we were going to move forward, and if we wanted to target Indianapolis, Greg telling me, well, KG actually goes out and provides, and this is my phrase only, what I'm going to call case management light to the households they serve. They literally walk them through, how do you put an air filter in? Here are ways that you need to ensure that you're cleaning your house. Here are the things you need to look for. That customer service is so important for the population that we are serving, that we really wanted to use this grant as an example of how a community action agency can go above and beyond in providing that quality customer service. We are also lucky in that within Indianapolis, we have what's called the Indy East Promise Zone. So for those of you who aren't familiar with promise zones, they were designations made, I think between like 2014 and 2016, as a partnership between HUD and I believe it was Department of Ag at the time, for preference points on federal grant applications. And so we have one on the Near East Side, which is also one of the most concentrated areas of poverty in the city of Indianapolis, but they have a very strong community neighborhood center, who is their lead entity, and they partner with the city of Indianapolis. And so within that, we are also able to get bonus points, but then also concentrate a lot of our funding on the Near East Side of Indianapolis. The other thing I want to note is what does the deferral data tell us? And these are actually screenshots specifically from our application. If anyone is interested, for the sources in where we got this where we got a lot of this data, I'm happy to send that out to you. as well. But one of the staggering statistics was the deferral rate that KG had estimated for Marion County. And I did the math before this presentation. So they were approximating 31% of their units had to be deferred, which is a staggering number of units. And we know, and Greg's going to talk about this later, some of the top reasons why, and some of the top reasons why are the items that this grant and the Healthy Homes Production Grant can directly assist with. And then other data I just want to point out. So we see a high prevalence of asthma both in children and adults, and then a really high number of emergency department use for asthma in 2019. That was the earliest data we could find. And so combining all these statistics, all this data together really tells the story of high need, and really led us to wanting to be able to move this forward. Next slide, please. All right, application tips. I was trying to think when I wrote this slide, what would I have wanted to know before writing this? I will let you all know this was the longest grant application I've ever written in my entire life. I did it over the holiday season, but so excited that we got it. My number one tip is do not write this alone. I was very lucky to work with Greg and a member of his staff, Jolie Pope. And Jolie was fantastic in really taking the lead on weaving in the weatherization components into our grant, so we could really tell that story of collaboration. This is a really long application. It is a federal application. It is complex, and so definitely think through those partnerships, internal, external, to be successful in putting together this grant application. Next, please establish partnerships before you start. Identify roles and responsibilities. Those might change, but at least you can have those conversations starting now. And you'll need to have at least some preliminary commitment because you're going to have to integrate that into your budget. So you'll really need to know who your partners are, what are their roles and responsibilities for your program design, your identification of key personnel. And then one thing I also note, in the case that you aren't funded, you've established these partnerships, you may be able to carry that forward even without the grant, or come back for the next NOFO. Thirdly, outline your workflow and work plan. This will help you if you are funded later down the line, because this will be the foundation for your work plan, which will be due to HUD on how are you actually going to implement your grant. And it'll also help you sort of organize your strengths and your challenges, and identify those areas in which you may need to seek out additional partnerships or bid out work. And then I'm really going to just talk about the last bullet. As with any great federal grant, there are a lot of forms, attachments, and requirements. Read all footnotes, endnotes, and just go through the NOFO with a fine-tooth comb to make sure you do not miss anything. Next slide.
So I'll go ahead and hit on kind of some of the other numbers. So as Sam mentioned, I think working together gave us both a lot of insight into other programs that we live in our siloed worlds, and it's very easy just to remain there. And one of the things that gave us the opportunity to do was just explore other avenues that are very related. And so, as she mentioned, even if we had not gotten the funding, I think it broke down some internal barriers and just kind of gave us some foresight for how we can better operate as an agency moving forward. But some of the reasons where it's helpful for weatherization, this internal collaboration. So statewide, our deferral rate is about 50%. As Sam mentioned, Marion County is about 31%, but because it is the most populous city in Indiana, 31% is under that average, but it's a huge number of homes, just based on how populous the county is. So the main reasons for deferral are listed there, but in bold are just kind of the ones that are really even more applicable to this grant that are targeting kind of asthmatic conditions. But mold, moisture, poor indoor air quality are things that we see often. And certainly the extent of mold issues or moisture issues can vary greatly. But all of those really have a negative impact on asthmatic conditions. So it's going to allow us to kind of address those really well. Another reason why this is important for us, in a typical program year, we receive anywhere from 8 to 9 million in DOE funds for weatherization. With the bipartisan infrastructure law, Indiana received our awards a little over 90 million over that 5-year period. So all that to say is, we have a lot of money from DOE that we can spend on weatherization, but we need the housing stock to be able to do that. So this cooperation demonstration grant really gives us more and more funds that we can give to a single home, which is going to help get those homes out of deferral so that they can then be weatherized. Next slide, please. So again, we touch roughly 800 to 1,000 homes annually with DOE on the weatherization side. We allow our subgrantees an average cost per unit of about $8,000. So they can spend $8,000 of DOE money on each unit. Indiana gives about 9%, a little over 9% of our LIHEAP funds to weatherization, which means that they can then spend an additional $9,000 in LIHEAP money to weatherize a home. And that's fantastic. But with the increased cost, labor, supplies, staying within those ACP, staying under that ACPU can be a challenge. We have weatherization readiness funds from DOE, which is really, really useful in getting homes out of deferral. But as we start to use those funds, we've seen the need that once our subgrantees get in the rhythm of getting homes out of deferral, these extra funds through this grant really just lend itself to being able to do more and more to a home. And as anybody familiar with weatherization knows, we have one shot when we spend DOE dollars. We can't go back in for 15 years. So it's really, really important for us that when we get the opportunity to help a home out, that we're doing as much as we possibly can to that house. So we get a little bit of DOE funds, some LIHEAP funds that go into it, and then this grant gives us even more funds to get to address some issues that we maybe couldn't in its entirety, or to do even more. And so all of that has been tremendously exciting as an opportunity for us to do in pilot in Marion County. Next slide, please.
So I quickly just want to go over our partnerships that we were able to establish and hope to continue onward with this grant and our other grants. So first, again, our Community Action Agency or Community Action of Greater Indianapolis, KG, without which we would not be able to do this pilot. I'm very excited to work with them, to be able to give them that space to do what they need to do to, again, be successful at providing weatherization and to really target that deferral list to get that 31% down. Secondly is the Indiana Community Action Agency. We have worked in the past with their training cohort, and our intent is to utilize their trainers to provide training to all community action agencies on healthy homes assessments across the state of Indiana, which will also help serve our Healthy Homes Production Grant. So our hope is that we could continue to build that training portfolio. Our hope is that we can have additional healthy home production grantees in the state of Indiana. So, if we could decide, we could target certain areas of the state if we know that there's another production grantee in another city or region. The John Bonner Neighborhood Center, this is the Promise Zone lead entity. They have been very gracious in allowing us to work alongside their AmeriCorps Vistas. And they are actively working on marketing our program already for us, meeting with community health, social workers, and the other neighborhood centers across the county to talk about how folks can get on our wait list for all of our programs and to really help promote also the weatherization services that KG provides. And then lastly, and this has really been sort of come out the last 2 months of our work, are new partnerships with the Marion County Health Department as well as the Indiana Department of Health. We did have an existing relationship with the Department of Health, the lead services side, and we've been able to tap into the asthma prevention team. And so we're actively actually working on an MOU right now, so we can all share data with each other, which will help them actually in the future, hopefully with future applications for funding. But it also helps us triage those folks. It helps us think through that referral network to all of our programming and all of their programming, and really look at those long-term outcomes. Were we successful in this endeavor or not? Next slide, please. So this is our proposed workflow. I will say again that this is how we have tentatively designed our process. In part, noting our history with wanting to do a deferral focused program in the past with the different community action agencies across the state. IHCDA has a strong capacity to administer HUD grants, in that we probably administer 15 of them at any given time. And so our Healthy Homes resource team will actually oversee the enrollment. So I think Brenda or Damien had alluded to this earlier, on the income qualifications. And so one of the great things about this NOFO is that DOE and HUD have streamlined that income qualification process. So you only have to use one standard and not two, which was a huge setback for us previously. And so my team is well versed on doing what we call the Part 5 income review, and then can do that on behalf of our partners, and we can move on. They're also well versed in the environmental review in Section 106, which is the historic preservation review, and so can also take that work on as well. That will allow our partner KG to be responsible for other work, which is less focused on the actual day-to-day of the HUD regulatory requirements. So maintaining that deferral list, identifying those referrals, conducting the Healthy Homes assessment, developing that scope of work, not just for weatherization, but also on the Healthy Homes side, doing that final inspection of Healthy Homes, weatherizing the unit, doing their QCI, and then lastly, and this really goes to that, that case management light I spoke of earlier, providing, we have in our budget the ability to provide residents supplies. They do have to be specific to that resident and their need and the hazard that was addressed. But we have funding where we can do that, and we can provide that education. And I think that's really exciting. Next slide. So we do also, as the Healthy Homes Production Grantee, we have existing contracts already with firms who do radon testing, and who do lead inspection risk assessment. So we can lean on those existing contracts. We also have a bidders list already for our Healthy Homes interventions. We actually have a bidders list for radon mitigation, though surprisingly, we actually don't have that many units that need radon mitigation. So we have all that already, and so we can lean into those existing contracts and bidders lists without having to reinvent the wheel. My team and I, we're responsible for all HUD reporting. We'll handle claims management. We'll have that ongoing MOU, hopefully with our health department. But this will also then allow us to partner with KG and work collaboratively on the evaluation of the program and then on those referrals, and then really begin to track those deferrals over the long term. And I want to note that, I was lucky enough to be part of a roundtable discussion with other cooperation demonstration grantees, I think last month. And one thing that was noted, which, I've thought a lot about, is that the exact workflow, who goes first, how does this actually going to work? It's great to have a plan, but that the need of that unit may change. It may be different than the next unit. And so important to be flexible and important of communication with all of your partners and with that household themselves. Next slide. So why are we so excited? One, I get to work with Greg a lot, so that's really fun. But two, this allows us to braid 3 different funding sources. So I think Greg said the average cost for weatherization from IHCD is approximately $9,000. With our Healthy Homes Production Grant, the average per unit cost is $10,000, and with the Healthy Homes Weatherization Preparation Demonstration Grant, I believe it's $10,000. So we can begin to layer those 3 funding sources, which is very exciting. And the NOFO again has a lot of those flexibilities in. Has streamlined a lot of those federal processes. So when we do begin to layer DOE funds with HUD funds, we'll be able to successfully, hopefully, implement the strategy that we have thought up. In the past, we have done a deferral program with state community development block grant funding, and it was really difficult because, again, exposure and experience with HUD grants made that administration really hard and quite frankly not cost effective for our partners because the admin just was very minimal. So this allows us again to really rethink that model and then hopefully take those lessons learned and then if we are lucky enough we'll apply for another pilot in the future and really target another area of the state. It also has given us the ability to establish new partnerships. So internally, our 2 departments were able to break down that silo, which is really fantastic. And then externally, again, with new partnerships for each of us as we begin to think through all the different components of addressing those needs holistically. And then lastly, we're really excited to have these training opportunities for all community action agencies across the state on healthy homes. There are not many groups in Indiana that are doing this work. And so for us, it's really important to raise the awareness and raise the capacity of not just community action agencies, but units of local government that may be interested in applying for the production grant on their own, and then encouraging them to establish a strong relationship with their WAP subgrantees. Next slide. So thank you. Our contact information will be on the first slide of the slide deck, and certainly if you have any questions sort of outside of this, feel free to reach out to either Greg or myself.
Great, thank you, Samantha and Greg and Brenda and Damien. We do still have time for question and answer, so it's a 90-minute time slot. I would invite anyone who is still interested in hearing to stick around, but you are free to leave the webinar now if you're not one of the people who has asked a question. We have over 100 participants, and I have counted at least a dozen questions that have already been posed. So if you'd like, we can just go ahead and move through some of those. One of the questions that came in the chat as opposed to the Q&A, Casey Mitchell asked, does the grant Dr. Reyes is talking about not for people applying for the upcoming HUD grant due 11/7/23? So what is that HUD grant that's due 11/7/23, and how does it relate to this kind of a grant?
Not sure if we're talking about the healthy home, the healthy home and weatherization, and the NOFO is established, that is October the 31st. So I will be interested to see if she's talking about that one.
No, I think she's referring to the Healthy Homes Production. That
Got you.
one is due on the 7th at 11:59 p.m.
Okay, so Casey Mitchell, if you're still in the session, if you raise your hand, I think we can call on you if you'd like to speak out and clarify that for us. Okay, not seeing that. Then there was another question about the use of funds. So Andrew Isaacs asked, could this project be used with utility-based LMI program that is not funded through WAP? And I think I already figured out the answer to that, but let's have some discussion around that, because he's saying, what about with DOE IRA funding, IRA LMI homes? This could be a perfect match. So many of our weatherization subgrantees are operating a number of overlapping energy efficiency revenue streams. And so how does that play out with this particular grant opportunity?
This is Brenda. Let me take that one. The appropriation for the Healthy Home and Weatherization Cooperation demo actually wants to see the collaboration between these two grantees, the Weatherization Assistance Program and the Healthy Home Production. Any other funds can be braided if, if they have it, unless, WAP has any other say no in some of them. But for the purpose of this NOFO, for this grant, the two partners that actually will be following, and we expect them to collaborate with each other, is WAP and HHP. As I said, the grantee is developing the model. The grantees are going to tell us how they're dealing with this. One of the things, that we are responsible is to ensure that the fundings are used appropriately, that, we're not breaking any rules for the grants that are, neither WAP or HHP, in this case, neither for the Healthy Home and Weatherization Corporation. We have to make sure that it's not commingling of funds, and that we follow the regulations of each of the grants that we are utilizing. Again, we don't require match, and if they want to braid and it's allowable for the other, for weatherization, we don't have a problem in the Healthy Home and Coordination, for the grantee to braid other funds within.
Right. So what I'm hearing, and I'll ask Amanda from DOE to weigh in on this as well, but for our weatherization attendees, what this means is that in order to utilize this particular program, it has to be tied to a job that uses DOE weatherization funds. So the subgrantee may be also adding additional funds. You may have, and there's different language that is used in different places to talk about this. So you may be doing a job that braids in LIHEAP weatherization or state weatherization or utility weatherization or other kinds of weatherization or energy efficiency dollars. That does not preclude you from using this program as well. Like, the more braiding and leveraging, the better, but you have to at least have DOE funds involved. Is that correct, Amanda?
That is correct. Yeah, it is correct. Congressionally directed that it's about these two programs working together.
This is Brenda, they have to be together. And anything extra that you bring, we don't have a problem with it. But these are the base. These are the ones that we are tracking. And as Amanda said, the appropriation by congressional, it is required for both of them to be invested on it.
But Amy, as you were getting at, I think it will spill over and help with coordination with your other federal weatherization programs or even local utility dollars. But the focus of this grant has to be on those two programs.
Okay, and then getting into the nuts and bolts of the grant application, Bill in Florida said, how do we define poor energy efficient, or how do we confirm illness? And I think that's a question both for Amanda and for Brenda, because I think that's determined in the writing of the application, right?
Yeah. Amanda, let me grab the first one because my answer is short. We actually initially required to have a medical diagnose in writing. However, we are accepting, because what we are looking for basically is respiratory conditions, the self-certification, where, the family will say, yes, it's, if they have it, we want it. If they don't have it, they can definitely come and say, yes, my father, my kid, they have this respiratory condition, and then it will be self-certified. Again, as I said, mine is short, so I pass it on to Amanda, what they were asking about the energy burden.
Yeah, as far as the energy burden, I would encourage you, to work with your state, what's in their state plan, as far as how they are allowed to determine cost effectiveness. As you know, our program has to focus on the cost effective measures, and that's how you would determine, what is energy inefficient and what will go on for weatherization.
Circling back to our Indiana panelists, how did you address those two metrics in your program?
I'm sorry, could you repeat the question?
How did the folks in Indiana, for Greg and for Samantha, how did you address those two metrics in your program? How are you defining energy efficiency and health, whatever the other question was. I actually closed it out. Hold on. How do we define poor energy efficiency or confirm illness? How did you tackle those two metrics in your program?
It's a good question. I don't know if we actually have a plan yet on those. I do suspect on illness it will be at the minimum a self-certification. Certainly coming from if it is a referral directly from the local or state health department, we will have that documentation in hand. With a lot of our program design, unless specifically required under HUD, our program has been our approach has been to create as few barriers for that household as possible, because that the work is so important to get done. We have also struggled, and this is less through the Healthy Homes Production Grant and more through our lead grant. There is often a distrust when you ask for medical documentation, and there is sometimes a fear of individuals, particularly if they have children, of being reported in to child services. And we actually had a local health department on our last lead grant who told us they used to do that, and which is why they struggled getting anyone to participate. So for us, as of now, it'll probably be more of a self-certification unless we get that referral documentation. And then, well, with a lot of our policies and procedures, we try something and we find that it's not really meeting the need of our grant to ensure that we're meeting HUD compliance. We will update our policies and procedures and our work plan, and retrain staff and our partners, and then work with our families to get that documentation if we need it.
Right. So the takeaway is to make it as easy as possible when you write the application. Go ahead, Brenda.
This is Brenda. I would like to add something because of what Samantha was describing, is that we went into the flexibility. We do understand, of the issue. And I want to remind, anybody that is interested on applying, as well as the one that already have it. The purpose of this is for the grantee to actually submit to us the model that they follow, in order to be successful for this. That is what the appropriation is asking from us. We want to see the model, how all these organizations are collaborating and they are, responding to these type of challenges. We want to learn from their experience. So we are not being prescriptive. You have to do this. We are asking them, partner, discuss, dialogue, because we are looking for the results of this.
And Brenda, there's a couple other technical questions about the application process. So Becky asked that, she said, you say $5 million is available, but the NOFO actually says 9 grants and $9 million are available. Yeah. Is that just a typo or what's that?
No. That's correct. On a yearly basis, we received $5 million. We had in the last round in 2022, we only received only one application actually was eligible to receive the funding. So we have the $4 million from the previous year. So we have $9 million in this opportunity, which will allow it. However, we only receive $5 million per year. So this is a carryover from last year.
Okay.
And that's the reason that we not say $9 million. We are expecting to receive 9 applications.
And that's kind of speaks to the origin of this particular webinar, where I think both federal agencies were disappointed that you didn't get as many applications as you were hoping for last year. So that's kind of why we're here today, to encourage more folks to apply. So it's exciting that somebody already read the NOFO. So yeah, I know that some of our attendees are out there doing their homework. Another technical.
Thank you very much.
I'd like to kind of conclude our Q&A session on another technical question about the HHP grantees. So there is a list that is in an Excel spreadsheet, and I want to thank HUD for taking the time to compile that list for us, because it's not like publicly available on a website. So they had to kind of pull that from their records. And there are quite a few Healthy Home Production Grant recipients around the country. When I looked at the list, there are 39 states that have Healthy Home Production Grant recipients in them. Some of them have several and some of them just have like one. But that leaves, I think, 11 states, if I can't count very well, but I think there's 11 states where there are no healthy home production grant recipients. So somebody from Kansas asked, if I'm in Kansas and there's no recipient in Kansas, how does that mean nobody in Kansas can apply? So how does that work? What do you do if you'd like to apply and you don't have an HHP recipient in your area? Can you cross state lines? What if you're in Kansas City, Kansas? Could you cross over and work with somebody in Kansas City, Missouri? That's just an example, but how do you navigate all that?
Damian, let me start and then I'll pass it on to you. We need both grantees to be in the same jurisdiction or agree to work in the same jurisdiction. The grantee will let us, and I'm talking about the Healthy Home Weatherization Cooperation. If you're, whenever you have this and you are in Kansas City, but you don't have anybody else and you want to work in Nevada, just making it up, okay? If you partner with them and you offer that will be your jurisdiction, that's where you're going to be working, that become the same jurisdiction for both. The requirement that we have is that both grants cover the same jurisdiction, because most of the time, whenever, not most, whenever you submit the grant to us, you tell us the boundaries of your jurisdiction, so the money is going to be used in that jurisdiction. And that is, we want that in that jurisdiction, both grants have the ability to work within it. That will be for the weatherization. Damian, if you have something, or Amanda?
Yeah, I'll go next. So what I would like to reemphasize is, for those communities or states that do not have a HHP grant or Healthy Homes Production grant, just to reiterate again, eligible applicants are states, counties, cities, Native Americans, and nonprofit 501c3 that's designated with the IRS. So if there is not a active grant in your state or county, if you fit that criteria, absolutely you should apply. We encourage you to apply.
Damian, there's a newer question that was posted. If somebody is going to apply for the Healthy Homes Production Grant now for 2023, could they apply for the demonstration grant as well?
So with the depending on the program manager, Brenda, can you tell me about your allocated time? I know on the HHP, the Healthy Homes Production, the program manager must spend 50% of their FTE on the HHP grant. So if you do not have another, program manager per se, and the reason I emphasize that, that's sort of like the lead for the Healthy Homes Production grant. But if that's not the case, then you may be able to apply for the weatherization as well as the Healthy Homes Production.
But we were looking, and thank you, Damian, this is Brenda again. What we're looking definitely whenever we revise is the experience of the program manager. We are looking for somebody that already has some experience on it, not to start, especially if you're going to be applying to 2 grants for the first time. We need somebody that has experience on this, and that's what Damian was talking about. Damian, regarding the time that they're going to be investing for the Healthy Home and Weatherization, we did not put 50%, 75%. We did not put a minimum of time. However, you need more than an hour, for example. It's a reasonable time that they can apply, but we did not request it the time the way that Healthy Home Production does have that requirement.
Okay.
And Amanda, do you have anything to comment on this?
Nope. You got it.
I'd like to say, since we still have a little bit of time, for the benefit of our broad and overlapping audience. So we've got the HUD, the attendees that are affiliated with HUD entities, and we have the attendees that are affiliated with weatherization entities. So for our HUD folks, the weatherization program, we should have had a slide like this, but the weatherization program is the federal funds flow through 57 state grantee offices. So there are 57 states, territories, and tribes that receive those dollars, and then they flow down at the local level to a network of about 700 weatherization subgrantees. And so some of those subgrantees are for like a single county, but they're separated by county. So there are some that cover one county, like Wayne Metro covers Wayne County in the Detroit metropolitan area. And then you have some that cover large swaths of territory. There's a community action agency in Illinois that's called Tri-County Community Action Agency, and they cover 9 counties. So out in rural areas, they're more likely to have a larger service territory. But of those entities, their jurisdiction, the size and scope of their jurisdiction can vary. And for the weatherization folks, I think it would be helpful if somebody could explain to us who your healthy home production grantees are. So I took a look at the spreadsheet, but could you explain, like, who are these potential partners for the weatherization folks? If they're looking to figure out who can they partner with, is it their local public housing authority? Is it like their local state? Is there like a state healthy homes office? Who receives these funds? Who is this population of potential partners?
That was for Damien, for healthy home production.
Anybody that thinks that they can sort out what my question was. I just said a lot of words.
Yeah, that's for the partners for the weatherization specific, Brenda.
Well, I'd like to know who the healthy home production grant recipients are, like who are in that spreadsheet that we're going to send.
So
is it like,
and you're talking about their like their designation, states, counties?
Mm-hmm. Yeah, are they like city offices, county offices, states? Are they administrators? Who are they?
No, they are states, counties, cities, and 501c3 designations within that list that we provided. Those are active grantees at this time.
Okay, I don't see any other unanswered. Oh, we do have a fresh question. The environmental assessment is the most time-consuming part of the process and doesn't guarantee eligibility until complete. Who covers that cost? That might be a question for Indiana, because I think you talked about who does what.
So we actually charge our tier 1 and tier 2 environmental review time to our Healthy Homes. Well, currently it's our Healthy Homes grant. We can also have that covered under the Healthy Homes Weatherization Cooperation Demonstration Grant. With those programs, you're going to do a tiered review. With all of these HUD programs, you're going to have when you're thinking through your timeline, you're going to have several months of startup activities. So that might be, it's definitely going to be your environmental review process. That might be solidifying any contracts you need with your partners or formalized MOUs. Do not sign them until your tier 1 is done, but you can at least get that going. You can work on updating your work plan policies and procedures. And if you do need to hire a manager, this is a great time to get all of that done. That being said, we do charge it back to our HUD grant. That also includes the cost for the actual publication itself, which is required as part of the tier 1 environmental review. And then all tier 2 work, again, we charge staff time to the grant as an actual week. In my mind, I call it a program delivery. So non-administrative expense based on how previous NOFOs have been written, though the actual publication itself would be a admin expense, if that helps.
It does. This is Brenda. Let me follow up on that. That is an allowable cost. And, the weatherization, the Healthy Home and Weatherization Corporation also requires to have the environmental review happen. And I know Healthy Home Production does have, Damien, don't let me talk for you, but I believe that is part of your requirements also, to have an environmental review.
Yes.
Amanda, do you guys require an environmental review to do weatherization on the units?
Well, environmental reviews, we have the NEPA determination that is a part of their grant. And so, and then Yeah, so we have categorical exclusions for most things done through weatherization.
I think on these grants, the HUD side, we don't have the categorical exclusion option, which is where I think both DOE and HUD do differ even under this grant. I will say, for those of you that have never done one before, our environmental review representative through all of these grants is fantastic. It's probably one of the best interactions I've ever had with that, and I work with some really great people. So they are there to provide you technical assistance and guidance so you can do it correctly. And as you go through those processes, they will go much faster and take up less staff time.
And just to again follow up, this is Brenda. In the NOFOS, we actually ask, especially the new NOFOS, we actually ask for the applicant to name who's going to be responsible to do the environmental review.
I have one thing to add as well. This is Damien again. For the 501c3 nonprofits, it's going to be critical to have that responsible entity. So if you have like a local government that you can interact with or join a partnership with, we have noticed that since we've kind of opened things up to the 501c3s, that has been one of the biggest hurdles with getting their tier 1 environmental review completed, having that responsible entity to sign off, if you will, or assist them in that process. So just wanted to bring that up as well.
Not to change the conversation from the direction of, but one of the things that we're really excited of partnering in this conference call, in this webinar, it is precisely because one of the things that we are identifying as a burden is to have the families that collaborate, that participate, and they receive the benefits of it, and is identifying the families within the community. That has been, and again, of course, the income verification that we are working now with the Department of Energy, but to be able to have a partner that, and I think that Samantha touched that piece, a partner within the community that help you, opens the door and improves the communication. So the community, the families want to participate and receive these benefits have been a challenge. So, it is very important for us to have this communication open for the new grantees.
Great. Well, thank you to our panelists. I don't see any new questions coming in. We had one last question about the 50% weatherization deferral rate in Indiana. Somebody wanted to know how many of those are mobile homes.
That's a fantastic question. I do not know off the top of my head, but I'd be more than happy to dig into that and get back to whomever asked that.
50% is a pretty high deferral rate, but it's not that uncommon. I think a lot of places have a deferral rate that high.
Yeah, and it varies amongst agencies. I mean, we get some that are higher. It just kind of depends on a little bit which part of the state what we're seeing.
Great. Well, thank you to everyone who stuck around for the Q&A. As I said, we'll circulate the slides, the recording, and the list of Healthy Home Production Grant recipients. I just looked at the spreadsheet myself and pasted into the chat a cross-section of some of the types of recipients that are there so that our weatherization network can see, there's a number of them that are like the city of such and such, city of Tampa, city of Greenwood. There are some larger, there's a community action agency, Greater Bergen Community Action, and there are some freestanding entities, like one of them was a Lancaster General Hospital, Women for a Healthy Environment, Community Service Programs of West Alabama. So if you are looking to partner with someone in your area, look at the list that we're going to send out, because you may be able to find somebody that you didn't realize was a potential partner for something like this. Thank you to everybody who participated, and I guess we'll go ahead and close the webinar. Have a good day.
Thank you very much.
Bye-bye.